A very good afternoon and welcome to Diplomatic Passport, your daily weekday COVID-19 show that keeps you up to date with Zimbabwe's COVID-19 effort, as well as looking at regional and international trends around the pandemic. My name is Blessing Munati, and this show is made possible by ZTN's partnership with the Ministry of Information, Publicity and Broadcasting Services. As usual, we start by taking a look at the latest figures released by the Ministry of Health and Childcare. Yesterday, 44 new cases of COVID-19 were recorded from 2,135 tests that were conducted. That's a 2.1% positivity rate and takes the number of active cases to 578. A single death recorded takes the number of fatalities to 4,684, while the cumulative number of COVID cases moves to 133,091, and of these 127,829 are recoveries, 50 new recoveries yesterday. Zimbabwe currently has 40 hospitalized cases of COVID-19, 7 are new admissions, 8 are symptomatic, 24 mild to moderate cases, and 4 of those that are admitted have severe symptoms, while 4 are in the ICU, that's intensive care unit. Now moving on to the vaccination program, 10,464 people received their first dose yesterday, and this brings the cumulative for the first dose to 3,336,079, while 7,305 received their second dose, to bring the number of cumulative people receiving the first and second jab to 2,618,101. Now, the issue of COVID and underlying conditions has always been a topical issue, but we do have other diseases that we still need to worry about: malaria, tuberculosis, and also HIV. Many of the COVID-19 vaccine studies have included a number of people living with HIV in their trials, and despite the limited data that is available, information does suggest that WHO has recommended Johnson & Johnson, AstraZeneca, Sinopharm, Sinovac, and Moderna, as well as Pfizer, as being safe for people living with HIV. And the current batches of vaccines that are available are either attenuated or have incomplete protein components, and this makes them have less risks and makes them able to be used in people with immunocompromised conditions, that's a weaker immune system. So the issue of co-administration and drug-to-drug interactions seems to be less in as far as the side effects are concerned with the vaccine, the co-administration of the vaccines, as well as the COVID-19 vaccines. Well, we did hear from the WHO director, that's Dr. Doherty, the director of HIV, hepatitis and STI programs, who sheds more light on this area.
Considering that people living with HIV have a 30% increased risk of death if they are hospitalized, and that we know vaccination for COVID protects people from both having severe disease and hospitalization and death, absolutely, people living with HIV should be prioritized for early COVID vaccines. We at WHO have been looking at the vaccines to see if they're safe among people living with HIV, and all vaccines currently right now on the market can be used among people living with HIV and certainly should provide adequate protection. There are many studies looking at whether people who have low immunity or people who have immunosuppression need to have another dose of vaccine, and those data are not yet clear, and we'll be looking forward to knowing whether people living with HIV might need a booster shot in the future. What we know so far for all the vaccines that are under emergency use right now around the world, they should all be safe in people living with HIV. None of them are using live attenuated vaccines approaches, which have been contraindicated in the past for people living with HIV. All of these vaccines that are out there now should be efficacious.
So studies are currently underway, and since the vaccines have been approved for emergency use, profiles on their safety and side effects continue to be gathered. Well, the fight against HIV has not been forgotten, especially in this time of COVID-19, and thumbs up to many advocates for the fight against HIV in this time. And one of them is a prominent Kenyan HIV and AIDS stigma warrior, that's Doreen Moracha, who has been championing the fight against HIV HIV and a stigma. And here she gives us tips on how to stay safe.
It doesn't matter whether you're young, old, living with HIV or any other illnesses. Everyone is at risk if in close contact with someone who has COVID-19. That is why it is important to ensure the safety practices that have been put into place and seek help if you show any symptoms. Remember to wash your hands, do not touch your face, cough or sneeze into your elbow, and also remember to keep the 1 meter physical distancing. That is, stay at least 1 meter away from each other.
Okay, and finally, we're back home right here in Zimbabwe, and the emergence of the COVID-19 pandemic and lockdowns that have affected education also saw the coming up of online education, and key amongst those is the introduction of access to gadgets for the children. But do parents have time to keep an eye on their children? Well, Wadzanai Nyanungo, who is the Chief Director of Learners Welfare, Psychological Services and Special Needs Education in the Ministry of Primary and Secondary Education, says that they have noted that kids did become exposed to disturbing content during this time of the fight against COVID-19, and they do need that regular coaching. Let's hear her speak.
During the lockdown period, at the peak of the lockdown period, when we reopened schools in August, in September, October and November of 2020, we realized that our learners had encountered things that they'd never seen before, and their behavior and attitude had changed. We saw that as a cry for help when all those things are circulating social media, that indeed our learners had had some exposure under lockdown in the cover of and behind closed doors at home and in their neighborhoods. We introduced a radio program where learners could speak, and through it they could get online support in preparing themselves for the challenges of life in preparation for work. And we are now spreading that to every school, to say every school there must be a functional guidance and counseling core team of teachers to interact with learners and also sensitize them on issues about their rights and their safety. And we're also part of the multi-sectoral protocol on the prevention and management of sexual violence in Zimbabwe. Thank you. And all that is part of our package as we continue teaching and learning under the new normal in this COVID-19 pandemic. Thank you.
That's Kwazanai Nyanungo, Chief Director of Learners Welfare, Psychological Services and Special Needs Education in the Ministry of Primary and Secondary Education, giving that advice to all parents out there. She was appearing, of course, before the Parliamentary Portfolio Committee on Primary and Secondary Education earlier today. Well, Diplomatic Passport comes to an end for today. My name is Blessing Munatse. Thank you so much for making us your choice. This program is made possible by ZTN's partnership with the Ministry of Information, Publicity and Broadcasting Services. Until we meet again, it's bye-bye for now.